Today is day 3 of 30, sharing information that you should know if you've been told that you have fatty liver disease or cirrhosis. And for context, my name is Amy. I'm a dietitian that specializes in helping people with all stages of liver disease. Did you know that women have a higher incidence or higher risk of alcohol-related liver disease if they're consuming alcohol in excess? When I tell people this, they usually assume that it's because of kind of general smaller body size of women in comparison to men, which is definitely a factor. But the other big reason is that women genetically have a lower amount of enzyme called alcohol dehydrogenase in their stomach that helps with metabolizing alcohol as you're drinking it, which means more damage to the liver, even with a smaller amount of alcohol. In addition to this, there is a disparity in who receives liver transplants, with men being more likely to be transplanted for alcohol-related liver disease. This disparity is because of the way that MELD scores are calculated and it favoring men in comparison to women, giving them a higher MELD score and a higher chance of being transplanted. MELD score is the way that the transplant system decides who is the most sick and therefore who gets a liver transplant. Historically, MELD score will underestimate the risk of a woman dying from liver disease in comparison to its ability to estimate the risk of a man dying from liver disease. Luckily, a few months ago, the MELD scoring system was updated to even the playing field between genders so that this disparity no longer happens. So the takeaway point of this is that everyone, especially women, should check in with yourself. If you recognize that you're drinking alcohol as a coping mechanism for past trauma or stressful life in general, make sure you seek help. Please reach out to someone and get the help that you need so that you can feel your feelings and not use alcohol as a way to blunt the way that you're feeling.